Good evening. I'm Dr. Nikita Deshmukh. I'm a senior ENT surgeon in pediatric ENT, and I work with King's Hospital at Kondapur and Sunshine Hospital at Pachimodi. Today, I wanted to discuss a few issues. Like now that the blazing summer onset has come, we are seeing quite a few patients now with problems in the nose. What happens is, because of the hot summer, the nasal mucosa, that is the covering of the nasal septum, dries up, and as a result of that, there are a lot of patients, both children and adults, who present with active nasal bleeding. Nasal bleeding is a very scary symptom, obviously. So if it is in a small amount, it's fine, but if it's profuse nasal bleeding, then you have to rush the patient to the hospital. The reasons for increased nosebleeds is one, dry heat in the summer. The second thing is, if there is a problem in the clotting or the bleeding mechanism as such, it can give rise to nasal bleeding. Apart from that, you also see patients with nasal masses, like especially young adolescent males with nasal masses, which is called as juvenile nasal angiofibromas. They also present with nasal bleeding. In elderly patients, the blood pressure problems are the reason for nosebleeds. So the sphenopalatine artery, the nasal septal arteries, because of the pressure, give way, and as a result of that, nasal bleeding happens. So these are the common scenarios which we see. Apart from that, in little children, when they go out and play in the hot sun, that gives rise to dryness of the nasal cavity, which leads to hard mucus collection, and that causes irritation and itching in the nose. So as a result of that, the children tend to pick their nose or blow the nose hard, and delicate areas in the front of the nasal septum, which is called as the Little's area, is covered with a mucosal surface. So that also gives way, and that gives rise to recurrent nasal bleeding. So what should we do if someone comes like this with nosebleed? Like at home also, there are certain things which you can do. You make the child or the adult rest with pillows under the head, so that you can give a head high position. With the head high position, the nasal bleeding tends to stop. The second thing you can do is take ice on a handkerchief and place it under the nose. This will also stop the nasal bleeding. Then there are certain hemostatic gels which are available. If it's a case of recurrent nasal bleeding, it's a good idea to keep those gels at home, so that they can be applied inside the nostril and the bleeding can stop. If the bleeding does not stop with this also, then you need to get the patient to the hospital. In the hospital, the nasal packing is done and the bleeding is stopped. The patient has to be admitted. And then in some severe cases, we take up the patient under general anesthesia, examine with the endoscope regarding the source of the nasal bleeding, and we cauterize the breather. So these are the different ways in which we manage the nosebleed patient. The reason I am sharing this video now is because in summer season, the nosebleed incidence is common. So if you are able to handle it at home with simple measures, well and good. Otherwise, you need to see your local ENT. Thank you. You can pass on this information to whoever you know, so that it will be useful for them.